Hi everyone, it's Tawa Dowling here of TD Aesthetics and the Skin Collaborative. So today I wanted to talk to you about acne scarring and a little bit more about pigmentation after acne. So let's start with talking about acne scarring, what causes it and what you can do about it. So acne scarring is basically the process by which collagen fibers are laid down irregularly after inflammatory and disruptive reactions from acne spots and breakouts. So laying down collagen fibers is the skin's way of healing after injury caused by acne. So when pustules of acne form, the skin is stretched, the follicle is stretched, so the collagen fibers become irregular. Hence you get irregular patterns and textures on the skin. So typically picking at acne spots, by the way, actually makes that worse. It exacerbates the damage. So that's why people always say to you, don't pick your spots when you've got acne, because you will end up with quite severe scarring. And there's different types of acne scarring as well, in terms of the way that they are formed, the depth and the severity in the skin. So, for example, ice pick scars, so called because they are quite deep and narrow and quite pitted. So you get scars that typically will form all over the face where you've had acne breakouts. You can also have rolling scars, which are broader and they have a little bit of a sloping edge, so they're slightly raised or have a deeper edge. You've also got boxcar scars. Now, boxcar scars are like rolling scars, but they've got a much more sharp defined edge, so you can actually feel around the edges of the boxcar scars much more easily. Atrophic scars are flat and they're thin, so they're visible but they're not immediately palpable. And hypertrophic scars are palpable. They are like keloid scars, they're thick and they're raised and you can feel them as well as see them. So what kind of treatments are there to minimize the appearance of acne scarring? Bear in mind that depending on the severity of acne scarring, you may not be able to get rid of them completely, but you can certainly minimize their appearance and make your skin look slightly smoother in texture. So one of the treatments that can be used is a technique known as subcision, which is where it's a surgical type technique, basically, because you're using a needle to physically and manually separate out those irregular strands of collagen fibers under the surface of the skin. Subcision may or may not be used with other products like hyaluronic acid fillers, for example, to help to volumize and smooth out that scar even more. If you're going to go for subcision treatment, you should really check out the qualifications of the person undertaking the treatment to make sure that they do know their way around a needle and they know their facial anatomy, because they can actually make the scarring worse if they go in at too deep a level or if they cause more trauma in the wrong place. Another way to treat acne scarring is by using chemical treatments, so chemical peels to exfoliate the surface of the skin and try and smooth out that irregular texture of the skin caused by the irregular collagen formation. So it just exfoliates the top layers of the skin, and it allows normalized dermal and epidermal skin tissue to be laid out and to actually see the smoother skin that shows afterwards. Another treatment is laser resurfacing, typically with an ablative laser, which means that you're basically just trying to use almost a mechanical exfoliation but with a laser beam. Similar results to a chemical peel. Some people find that laser can be a little bit invasive, or at least for the downtime, because your skin reacts with a lot of inflammation afterwards to the ablative laser. So you might want to consider whether or not you are better off going with a peel or with a laser, depending on the severity of your scars. Also, microneedling or skin needling is an excellent way to address superficial scarring. Microneedling isn't suitable for every type of scarring. For example, if someone came along with quite noticeable hypertrophic scars, which are very raised, keloid type formation, I wouldn't recommend microneedling, because that actually might make the problem worse, and the skin may lay down even more excessive collagen fibers, causing bigger and more noticeable hypertrophic scars. So microneedling isn't for everybody, but for those people who are suitable for microneedling, they will find that their scars improve drastically because the body heals itself with new collagen fibers that are laid down in a much more stable fashion. So you get much smoother skin as a result. And finally, you can also use steroid injections directly into the scarring. Now, this is suitable for those that have hypertrophic scars because the level of inflammation within that scar tissue will be calmed down by direct steroid placement. It can be quite painful, as you can imagine, because you're literally injecting into each individual scar, and it's really suitable for people who have quite severe keloid or hypertrophic scarring. So I hope that's helped you all to understand a little bit more about what acne scarring is and what you can do about it. Remember that inflammatory kind of cascade that you get with acne will result in skin changes at a cellular, dermal and epidermal level. So there will be scar tissue, particularly if you're disrupting the surface of the skin by picking or scratching at your spots. Always, always, always try and keep your hands away from your skin when you've got acne breakouts, if only not to spread the acne bacteria, but also not to damage the skin further. Hope this has been helpful, but if you've got any further questions, get in touch with myself or with any of my colleagues at the Skin Collaborative, and we'll be more than happy to answer your questions. Have a fantastic day. Bye for now.